For me, the most exciting part about the digital age in healthcare is the potential that we have to help people understand and have more control of their healthcare. And there's a learning curve to that. People first have to understand what it means, but once they do, then it opens up a conversation, and then they are in a better position to care for themselves. Healthcare today is complicated. It's not like in the old days when there was one doc for the whole little town, and now we have a lot of specialization in different places, and so keeping track and making sure all the physicians are in the loop. That's one thing that we found with the electronic health record that is very helpful, because now we can talk about having synchronous communication, telephone, this is really, really important, or asynchronous communication. Let me just send you a task and I know that you're going to get it, and when you get to it, you can send me that information back. And so now I can say to my patient, you know what, let me make sure that Dr. So-and-so knows about this, and then that way when you go and you see them, they'll already know that we've talked about this. I think a connected physician would use their smartphone, and right now WellSpan has an app on the phone, and I can use it to go in and actually look at my patient's electronic records. I can make notes. I can send tasks to my staff. And one of the things that we're working on right now is something called electronic visits. We call them e-visits for short. And what falls into that category could be care that I give or talk to someone over the phone. That's the easiest way to conceive of it. But I could do it through email. I could do it through video chat, right? How do we work through the steps of what that would look like? What if a physician in one of our practices said, you know, I would really like to see some of my patients like that? Or what if an employer says, you know, the time that it takes for my employee to leave work, drive across town, wait in a waiting room, get seen, and then drive back, what if that was just done virtually? So we are looking into how can we make that work. I think it's very exciting. I think the opportunity is huge, and I think we need to figure it out. WellSpan has over 19,000 active users of the My WellSpan portal, patient portal. And that means we know that 19,000 people in our community are signing on, logging in just like they do to their banking account, and can have access to their own medical record. Patient engagement is so important because as a physician, I only interact with my patients if they have a chronic condition face-to-face maybe 4 times a year, and that's for 15 minutes, so we're talking 1 hour a year. Everything else is in their purview. It's their world and the choices that they make. But to be able to have either a website or on a smartphone that's specific to the person's question or condition, for example, is having a prostate-specific antigen, a PSA, right for me or for a patient. They could go on and find education targeted to that question. And then I think that what that does is help with shared decision making. But you have to have the right tool for the right situation. I would never want to tell someone that they had cancer over the phone or in an email. It needs to be face-to-face. But helping them to understand more what the process is about and what to expect, they can get that from a tool on the smartphone or something like that that could help set them up for a more meaningful conversation when they do talk to their provider. I like to start, when I talk to physicians and staff, think about where Amazon was when we first ordered a book back in the 90s. It took a long time and it was slow, and I can remember saying, I'm just going to get up and drive to the store and go buy the book. And I contrast that experience to now, and it's automatic. I can just click one button, it's bought, it comes to me. I think that's where we are as an analogy in healthcare right now from an electronic perspective. I think that things are just starting to rev up with electronic health records, a patient portal, apps that we can have on our smartphones. I think we're just beginning to see it, and the future is not too far out that we're going to really be able to change the way that we deliver care and that we receive care, so that as our communities improve, we can improve our health. We're in this together.